Hi, everyone. I'm Jennifer Johnson, the Director of Family and Community Outreach at Golisano Children's Hospital, also a parent. So, as a parent, I know there is so much to learn in being a parent, including what to look for when a child isn't feeling well. Well, then throw in the COVID-19 pandemic, and things become even more confusing. Like right now, when common colds and other viruses that stayed at bay for a while because of the pandemic are back. This was something that health experts really warned us about as school started up again. But here we are, early November of 2022, and we are seeing it. Hospitals and doctors' offices across the country are very crowded right now. Dr. Elizabeth Murray works for Golisano Children's Hospital in the Pediatric Emergency Department, and so she's seeing this firsthand. And Dr. Murray, you're also in touch with a lot of local pediatricians' offices that are very busy right now, and they had a request for us in this recording, didn't they?
They did indeed. So we know that parents of young children, toddlers, 3 and 4 year olds, have not faced a lot of illness in the past few years. As you mentioned, we kept a lot of germs at bay and they were waiting in the sidelines for their chance to come back, and they are now back. And so, as a parent of a child who hasn't really seen a lot of illness, it can be really hard to kind of gauge, when do I need to worry? What are the things I can do at home? And so, we wanted to take a moment and talk about that.
I know as you see patients, as you talk with parents, I know one of your pieces of advice is to, as the parent, use themselves as a barometer. What does that mean?
Yeah, we all know that 2 and 3 year olds are usually full of action and they are always on the move. And then to see your child really want to rest can be very surprising. And certainly it's very unusual because that is not how they normally act. And so, even though your child is quite young, I think it's totally appropriate to say, okay, if I had all these symptoms, how would I be acting? And when you kind of level set it that way, it can be a really helpful gauge because a lot of times children are too young to really explain how they're feeling. But you say, all right, if I was full of mucus, if I had a fever, I think, when I'm sick, I want to rest too. And so if your child is acting in a level that seems proportionate with their symptoms, even though it's totally different than their normal behavior, it makes sense in that setting. If they have a fever and you give them a dose of fever controlling medicine and that makes them feel better, that's also a really important gauge because usually when that temperature comes down, they're more willing to have a snack, drink, keep themselves hydrated, do all those other things we want to make sure the kids are doing.
I know one of the really big germs out there right now is RSV. We're seeing a lot of it. And I know that's a real fine line of, okay, I'm concerned about my child. At what point do I need to seek professional medical help?
Yeah. So first and foremost, if you notice that disproportionate stuff is happening, your child doesn't have a fever, but yet they don't want to be active, that would be concerning. So if they're not acting like you would expect, but then the two other major areas are their work of breathing and are they able to keep themselves hydrated? So, for a baby, if they're having trouble breathing, they're also probably going to have trouble eating because they need to be able to breathe through their nose to take a bottle or to breastfeed. They also might start sucking in the muscles around their rib cage, flaring their nostrils. Kids who can talk might have some difficulty talking, or they might kind of catch their breath as they're talking, or also sucking in around their rib cages. If you're seeing any of those things happening, that's at the very least a phone call to your medical home, if not seeking care emergently. And then, if you have a child who's really not able to make their normal amount of wet diapers, really hasn't been able to take a lot in, or maybe is throwing up a lot of mucus and throwing up their feeds as well, reaching out to your child's medical home to get some advice there and make a decision of where they need to be seen for further evaluation.
I want to ask about flu in just a moment, but you talked about reaching out to your medical home. We just talked about they're very busy. Should we expect a little bit of a wait, or how are offices handling this?
Yeah, so the triage system still definitely is in play here. The medical homes, the pediatrician's office, family practice offices always have people available answering the phones, or they have a medical professional on call. It's the getting in for appointments that might be delayed a little bit compared to what you're used to, but that's why the triage system is so important. Having those conversations, discussions of symptoms, they can help you make a safe decision about when and where your child would need to be evaluated if they do need a medical evaluation. The emergency departments have always operated on a triage system so that there are times where you might have to wait. I kind of remind people that while nobody likes to wait, if your child is safe enough to wait, in reality, that is a good thing. We are seeing the children that are critically ill or the adults that are critically ill first. So if you are safe enough to wait, that actually is a good thing. If we could think of it that way, sometimes that could be helpful, but it is hard because you're right. People are potentially waiting. However, we will see you and we will be cared for. You will get what you need. We will always be evaluating children as soon as they arrive, and then making sure they are comfortable, get what they need to keep them comfortable, and then completing their medical evaluation.
I mean, just behind the scenes, we know everyone is doing all that they can to see these patients. Real quickly before we go, flu and COVID still very much in our community.
Very much so. The state health department puts out the flu numbers every Friday, and our new numbers this week just came out. About 75% of the cases of flu in the New York State right now are in children and teenagers. So the overwhelming majority are in children and teenagers. The case numbers total have doubled since last week. So flu is very, very much in our state and in our community. Still plenty of time to get yourself vaccinated. Even if it doesn't prevent disease, it will dramatically decrease the symptoms, which is just so very important.
Right, for the patients and everyone trying to take care of them. Well, to you, Dr. Murray, and everyone who is taking care of our kids, we thank you so much for all your hard work.
No, thank you. Good luck, parents. We know it's hard. You know your children best. You know your comfort level best, but help is available if you need us.